Why do testicular cancer risks vary globally? Testicular cancer risks vary around the world for several reasons, and understanding these can help us grasp the complexities of this disease. First, let's talk about genetic and biological factors. Some men have a higher risk due to family history or conditions like cryptorchidism, which is when a testicle does not descend properly. This condition is one of the strongest known risk factors for testicular cancer and is more common in certain populations. Additionally, ethnicity plays a role. Caucasian men tend to have higher rates of testicular cancer compared to men from other ethnic backgrounds. However, this could also relate to differences in lifestyle and environment. Next, we have environmental and lifestyle factors. Certain habits like heavy drinking, being overweight, or not exercising have been linked to a higher risk of developing testicular cancer. These lifestyle factors are often more common in wealthier countries, which can lead to higher incidence rates. Moreover, exposure to environmental agents, such as chemicals found in plastics or high temperatures from certain occupations, may also contribute to risk. However, the evidence on these factors is still being studied. Socioeconomic status and healthcare access also play significant roles. High-income countries, especially in Europe, report higher incidence rates. This is partly because they have better diagnostic tools and cancer registries that accurately track cases. In contrast, lower-income countries often see higher mortality rates. This is likely due to limited access to early detection and effective treatment options. Socioeconomic indicators, like the Human Development Index and Gross Domestic Product, show that countries with better healthcare systems tend to have higher incidence rates but lower mortality rates. Age is another important factor. Testicular cancer primarily affects younger men, and in recent years, we've seen an increase in cases among this age group globally. This trend emphasizes the need for early detection and preventive measures aimed at younger populations. Lastly, differences in diagnostic practices can affect reported incidence rates. For example, some countries may diagnose precursor conditions, like carcinoma in situ, more frequently than others. This can lead to discrepancies in statistics and understanding of the disease. In summary, the variation in testicular cancer risk worldwide is influenced by a mix of genetic, environmental, lifestyle, and healthcare factors. High-income countries often report higher incidence rates due to better detection methods, while lower-income regions face challenges that lead to higher mortality rates. Recognizing these factors is essential for developing effective prevention and treatment strategies globally. Always consult healthcare professionals for personalized advice and information.